this one, if
Mhm.
what would happen to the world,
Mhm.
how the world would heal.
Well, and that's interesting. So there's two things there. One, I guess I'll talk about the MDMA is the one that's very effective with PTSD, right? And they're finding that it's just with first responders, with veterans, like
Yes.
it is life changing for these people who have been through all these different forms of therapy and have been unable to shake these symptoms, right? Because it is hardwired into them. And MDMA is another psychedelic adjacent, and it opens us up to this euphoria and connection and love, and you experience emotion so much at such a higher level. But the testing process is broken. So the scientific method does not lean itself in favor of psychedelics. So MAPS, the program, or sorry, the association I mentioned earlier, they're kind of the forefront of most of testing within the last 20 years for psychedelics, and they were on this last trial, and they completed it. Results were very good, and they submitted it to the FDA for approval. And the FDA turned it down on the basis that it wasn't a truly blind trial, right? So obviously, you know what blind is, but for any listeners who don't, it wasn't a blind trial. Requires a placebo, a control group, and the ones getting the medicine, right? And then you are able to actively compare within the same variables of everything else. So one person doesn't get it, they get the placebo. One person does get the medicine, and then you can say, oh, did they benefit from getting it? And they said it's not truly blind because the people who got the medicine could tell that it was MDMA,